Are you confused about whether circumcision is the right choice for your health? You're not alone. Many men wonder if the procedure is necessary or if it offers real health benefits. In this video, we'll explore everything you need to know about circumcision, from its medical benefits to the risks you should consider. If you're looking for answers to this important health decision, make sure to watch until the end. Trust me, the information in this video could change the way you think about your health. Don't miss it. 1. The question of foreskin. The question of whether men should have a foreskin or be circumcised has sparked debate for centuries, influenced by cultural, religious, and medical views. In the modern era, however, with an abundance of scientific knowledge, the conversation is increasingly shifting toward health, function, and personal choice, rather than being solely shaped by tradition. The foreskin, medically referred to as the prepuce, is a retractable fold of skin that covers the head of the penis, also known as the glans. At birth, the foreskin is typically fused to the glans, but over time it becomes retractable, often by the time a child reaches adolescence. However, it is far from just an insignificant piece of skin. It serves multiple important functions for the body. Protection. The foreskin acts as a natural sheath, protecting the delicate glands from constant friction against clothing, as well as from exposure to bacteria, irritants, and other harmful environmental factors. This protective barrier helps to reduce the risk of injury to one of the body's most sensitive areas. Moisture and lubrication. The inner surface of the foreskin plays a vital role in maintaining a moist, balanced environment for the glands. This helps to keep the area lubricated, which can be particularly beneficial during sexual activity, reducing friction and enhancing comfort. Sensation. The foreskin is also rich in nerve endings, making it highly sensitive to touch. These nerve endings play a crucial role in sexual pleasure, and for many men, the foreskin is an integral part of their experience of arousal and satisfaction. While some may consider circumcision for medical or cultural reasons, it's important to understand the foreskin's functions before making a decision. Ultimately, the choice between keeping or removing the foreskin is deeply personal, and understanding the potential health implications as well as the function it serves can help individuals make an informed decision that aligns with their health needs and personal beliefs. In the end, whether to circumcise or not depends on individual circumstances, health considerations, and personal preference, and should always be made with care and full awareness of the pros and cons. 2. The medical benefits of circumcision. Circumcision, despite its natural biological functions, is often chosen for medical reasons. While the foreskin provides protection, moisture, and sensory functions, there are several health benefits linked to its removal. Here are the key advantages that circumcision can offer. Improved hygiene. One of the most significant medical benefits of circumcision is the improvement in personal hygiene. A circumcised penis is easier to clean since there is no foreskin to trap smegma, a substance made up of skin cells, oils, and secretions. If smegma is not regularly cleaned, it can accumulate and become a breeding ground for bacteria. By removing the foreskin, it becomes easier to maintain cleanliness, which can help prevent infections, odors, and other hygiene-related concerns. Reduced risk of infections. Circumcision can lower the risk of several infections, particularly those that are difficult to manage or resolve with hygiene alone. For instance, conditions like phimosis, where the foreskin is too tight to be retracted, and balanoposteitis, an inflammation of the glands and foreskin, are less common in circumcised men. Additionally, circumcision during infancy has been shown to reduce the likelihood of urinary tract infections, UTIs, particularly in the first year of life. UTIs in infants can lead to serious complications, so circumcision in early life offers an extra layer of protection. Decreased risk of penile cancer. Though rare, penile cancer is a serious concern, and it has been linked to poor hygiene, chronic inflammation, and human papillomavirus infection. Circumcision lowers the risk of developing penile cancer by improving hygiene and reducing the likelihood of HPV infection. Since circumcision helps prevent the buildup of bacteria and irritation that can lead to chronic inflammation, it offers a preventative measure against this rare but life-threatening condition. While circumcision carries many health benefits, it's essential to consider individual circumstances and consult a healthcare provider before making the decision. In some cases, the medical advantages of circumcision are clear, but the choice should always be made with full awareness of the procedure's potential risks and benefits. 3. The risks and drawbacks of circumcision. While circumcision offers several medical benefits, it's important to acknowledge that, like any surgical procedure, it carries inherent risks and potential drawbacks. Understanding these risks is crucial for anyone considering circumcision. Below are the key risks associated with the procedure. Surgical risks. As with any surgery, circumcision comes with risks of pain, bleeding, and infection. While these complications are relatively rare, when the procedure is performed by a trained and experienced professional, they can still occur. In some cases, excessive bleeding or infection at the incision site may require additional medical intervention. However, when performed in a sterile environment and with proper aftercare, these risks are minimal. Altered sensation. One of the most significant drawbacks reported by some men is a change in sensation. The foreskin is rich in nerve endings that play a role in sexual pleasure. Removing the foreskin can alter the sensory experience of the penis as the gland becomes permanently exposed to external friction. While many men report no significant difference in sexual satisfaction, others experience a reduction in sensitivity. This change in sensation can be subjective, and not all men find it to be a problem. But for those who do, it can affect the quality of their sexual experience. Permanent changes. Circumcision also brings permanent changes to the anatomy of the penis. The removal of the foreskin eliminates its protective and lubricating functions. The glands, now constantly exposed, may undergo a process called keratinization, where the skin thickens and becomes less sensitive over time. While this can reduce discomfort from constant friction, it may also lead to a decrease in pleasurable sensations. For some men, this change is minimal, but for others, it may have a lasting impact on their sexual experience. Ultimately, while circumcision offers health benefits, it's important to weigh these risks against the potential advantages. A thorough discussion with a healthcare provider is essential in making an informed decision. 4. When is circumcision a medical necessity? While many men choose circumcision for cultural, personal, or preventative health reasons, there are certain medical conditions where circumcision is not merely recommended, but a clear necessity. These conditions can significantly affect a man's health and well-being, making the procedure essential. Here are the key situations where circumcision is medically required. Phimosis. Phimosis occurs when the foreskin is too tight to be retracted over the glands. In mild cases, it may be manageable with good hygiene or gentle stretching, but in severe cases, it can cause painful erections, make proper cleaning difficult, and lead to recurring infections. When conservative treatments are ineffective, circumcision becomes necessary to relieve the discomfort and prevent further complications. Paraphimosis. Paraphimosis is a more urgent condition where the foreskin becomes retracted behind the glands and cannot be returned to its normal position. This condition can cause the foreskin to act like a tourniquet, cutting off blood flow to the glands. If left untreated, paraphimosis can lead to tissue damage, making it a medical emergency. Circumcision is often required to treat paraphimosis and prevent permanent damage to the penis. Chronic infections. Men who suffer from chronic infections, such as balanitis or balanoposthitis, may find that these conditions don't respond to antibiotics or improved hygiene. If infections are recurrent and cause ongoing pain or swelling, circumcision may offer a permanent solution. By removing the foreskin, it becomes easier to maintain hygiene and reduce the risk of further infections. In all these cases, circumcision is more than just a personal choice. It becomes a necessary medical procedure to preserve health and prevent serious complications. If you experience any of these issues, it's crucial to consult with a healthcare provider to discuss the best course of action. 5. Should you consider circumcision? The decision to undergo circumcision is highly personal, and it's important to understand both the potential health benefits and risks before making a choice. As a doctor, here's my perspective. Cultural and personal factors matter. For many men, the decision to be circumcised is shaped by cultural, religious, or personal beliefs. These influences are deeply valid and should be respected. However, it's also essential to consider the health advantages circumcision offers, particularly in terms of hygiene and preventing sexually transmitted infections, STIs. The scientific evidence supporting these health benefits is strong and should not be overlooked. Ultimately, you must make a decision that aligns with your values and health needs. Think beyond aesthetics. Many men focus on the aesthetic aspects of circumcision, feeling cleaner or more comfortable without the foreskin. While these perceptions can be valid, it's crucial not to make this decision based on societal pressures or purely cosmetic reasons. It's important to consult with a urologist to discuss your personal health, anatomy, and sexual function before proceeding. Understanding the full implications of circumcision can help you make a more informed decision, one that goes beyond appearances. Don't forget the risks. Like any surgery, circumcision carries inherent risks. While complications are rare, you should be aware of the potential for altered sensation or long-term changes in sexual pleasure. The foreskin is rich in nerve endings, and its removal may affect how sensitive the penis feels during sexual activity. If maintaining a certain level of sensitivity is important to you, this is something worth considering before undergoing the procedure. Weighing these risks against the potential health benefits is crucial for making an informed, balanced decision. In conclusion, circumcision is a personal decision that requires careful thought. Take the time to consult with a healthcare provider, consider both the benefits and risks, and ultimately make the choice that's right for you. In conclusion, there is no right answer to the foreskin debate. The decision to undergo circumcision should be based on your unique health needs, lifestyle, and personal beliefs. While circumcision offers proven medical benefits, including reduced risks of infections and STIs, it also has its risks, including altered sensation and permanent bodily changes. For those dealing with medical issues like phimosis or chronic infections, circumcision may be a clear choice. For others, it's a personal decision that requires careful consideration of both health benefits and risks. If you're considering circumcision or have questions about your health, it's crucial to consult with a urologist. They can provide a physical exam and offer advice tailored to your specific needs. Don't make this decision based on hearsay or online discussions. Get professional guidance.